and CEO for Grand Mental Health. First, I just want to thank everyone for spending some time with us today. You could be anywhere, so thank you for being here with us. And then thank you to our esteemed panelists for committing to be here and talking about substance use prevention. This topic, so I guess first I'll start by saying, so as a certified community behavioral health center, we look at our service to the community as something that we're responsible for other than just the serving the people in the community. And there's a difference there. And so when we're doing events like this, we really look at this as our duty to be giving back to the entire community. So we love this opportunity, and especially when we have people that know some of these subjects in and out to come and commit that time. For us, when we're talking about prevention, we do a lot of treatment services. And by the time someone's coming to us, often we're in a situation where we've missed that window to apply prevention services. So we love this topic. We talk about access a lot when it comes to treatment services, and we're always expanding this opportunity for ways to access our care. But this is the same thing. So today I'm hoping that we're going to hear ways to access this vital information that can help improve lives before treatment's even necessary. So again, thank you very much. And I'm going to turn it over to Tricia, who's going to be moderating the event.
Thank you, Josh. Well, today, Josh talked about a little bit of the reason why we're here. I do want to thank you again for being here. It means the world to us that you care enough about this topic to maybe learn a little bit or share a little bit with us. I am the Chief Experience Officer with Grand Mental Health. Josh mentioned my name is Tricia Walters. I'm excited today to talk about prevention first. I had a little bit of a prep call with the panelists, and I'm pretty excited to hear what they have to say. Um, Josh spoke about this, but as a CCBHC, we see the full continuum of addiction in our community. We meet individuals and families in moments of crisis. We meet them in active treatment, and best of all, we get to meet them when they are living their best lives in recovery. Um, we also see very clearly, as Josh mentioned, that by the time they reach us, prevention may have already failed to get it done for them, to be useful to them, or maybe had a chance to work. And so it didn't have the support it needed. Hopefully today we can all learn a little bit about jumping out there ahead and working toward stronger prevention. It's certainly not a single program or one initiative. I think that it lives in our schools, it lives in our workplaces, it lives in our healthcare systems. Prevention lives in policies, and it also lives in everyday decisions that we're making as a community. It's shaped just as much by economic opportunity and social connection, which I find very interesting, as it is by clinical care. Here at Grand, we care a lot about that clinical care piece, and I think that we've represented by our panel kind of all the other partnerships that are really required to succeed in prevention. Our goal today is to move beyond just awareness and potentially into action. That's really where we want to be. So today we're going to ask things and hopefully get the answers to what does effective prevention look like? Where are the gaps? And maybe finally, how can we together, all of us, build something that's proactive, sustainable, and I think the word impactful is really going to be meaningful to us moving forward. We brought together very respected leaders today. I'm looking at Mr. Gary on the end because he was excited to be here, and he has been here one other time. So I'm going to introduce them quickly. I'll let you guys say a little bit about yourself too, if you'd like, okay? So first we have Mr. Zach Stoikoff, President and CEO of Healthy Minds Policy Initiative. Welcome, Zach, to the stage. Thank you. Next, we have Ms. Kelsey McCutcheon. She is an LPC and the Program Director of Substance Use Disorder Services here with us at Grand Mental Health. Then we have Stephanie Andrews, Executive Director of Student and Family Support Services with Tulsa Public Schools. and maybe the best hair on the panel. Just saying. Then we have Captain Daniel Hurst.
I know.
I know. I'm sorry. I'm really sorry, Captain. You were a close second.
Okay, thank you.
Captain Daniel Hurst with Professional Standards Unit at Broken Arrow Police Department. And then we have Gary Shepard, Addiction Services and Overdose Prevention Program Manager with the Oklahoma Department of Mental Health and Substance Abuse Services. All right, so our first question is for the full panel. So we'll give you each a little time to answer. We'll start with you, Kelsey, on this one. We're here in the first week of National Mental Health Awareness Month. How do you see mental health influencing substance abuse and addiction in our communities? And what does it mean for how we approach prevention?
Yeah, so I mean, mental health is really one of the foundations of a substance use disorder beginning. I don't think anybody wakes up thinking that they're gonna develop a substance use disorder. I know I have family and friends that it's like they didn't wake up and say, oh, I want to be an opioid addict. That sounds fun, right? But looking at their story, looking at their history, there are things like trauma, anxiety, depression, grief, loneliness. I'm thinking of kids, this like urge to want to fit in. Those things are the things that lead to substance use, substance misuse. And so for me, prevention is helping people understand how to cope with those things before substances become the coping strategy.
Thank you very much. How about Zach?
Yeah, I think Kelsey, you really hit it on the head there. The things that lead to risk factors for substance use disorder are the same things that lead to risk factors for mental illness. Right. So we look at whether we are genetically predisposed to cancer, but if you smoke tobacco, you will likely get cancer. Now, somebody who is not genetically predisposed to get cancer may smoke tobacco their entire life and never get cancer. But what are those things? So we're growing up in communities and neighborhoods. We have low attachment to those neighborhoods. We don't feel safe. You live maybe closer to a marijuana dispensary than a park. Right? Those things matter, and they actually do. We can show you through research and data that they lead to greater risk for both mental health issues, depression, anxiety, or further along, or substance use disorder. And so when we deploy prevention strategies, I'm of the mind that we can target really folks who are really high risk of substance use disorder, but if we're talking about primary prevention, it's really the same spectrum of things that we should be talking about.
I feel like mission accomplished already. I've learned something in the first two answers, and we still have three to go. How about you, Stephanie?
When I think of prevention, specifically in schools, I think of pretty simple, right? We should have a school where kids want to go there, right? That would be a good first start. And like also the hardest thing for us is how do we make schools a place where kids do belong, right? We intentionally, we try all these things as teachers. I've been a teacher, a counselor, dean, administrator, I've been all the things. And sometimes our love language to kids isn't exactly like what they're looking for. But I would say starting with our smallest learners, it's teaching them to identify their feelings, right? Like actually naming the words that go with their feelings, and being able to tell us the truth when something happens and us not go, that didn't happen, or sit down, right? I think that's the biggest thing for me, all the way when we build that kind of school family around belonging and we listen to our students, then when they get older, and we are faced with many of the things you all talked about, they actually have language and words that then they can tell us what's going on with them so that we can help them. So for me, it's really around supporting our students to have that language of feelings. It's a language that I don't always have, right? We get mad and all the things, but I think that's one of the most important things that we can do in schools. I think you're next.
Yeah, go ahead, Captain.
I can jump right in. All right. Law enforcement is not just, enforcing the laws that are put on the books. We have been part of prevention for a number of years, but we have continued to find out is without our community involved, without the services from mental health and from the schools, that we can only do so much. That's the aspect of what happens in a lot of times when programs are defunded or things go away, it falls on us because we can't go away. And we find that, we've tried every different program you can imagine. You've seen DARE in the 80s and 90s and all that different stuff. You saw the successes and failures of those type of things. But that's just law enforcement trying to in of itself to fix a problem that they're not properly equipped to fix. It takes the entire community. It takes the school system. It takes the teachers. It takes the counselors. It takes, mental health professionals to be able to build that entire program. There's only so much that we can do. And be honest, most of our officers are trained to enforce the law, not to do all the other things that there are required nowadays to do.
Thank you. Gary?
Yeah. I think as we approach prevention in our communities, and it's already been alluded to up here, we have to expand what the addiction treatment continuum looks like. And we have to move beyond thinking that that only exists in emergency departments and inside law enforcement, institutions, or inside of treatment facilities, the schools, faith-based organizations. There are a lot of places that can make meaningful impacts to prevention efforts. And so I think if we kind of expand what we think of in terms of that treatment continuum, we'll have better improvements and results.
Did I lose it? There we go. Okay. I think we're going to talk about some of those things today, so I'm excited to jump into the questions. So Stephanie, how about we start with you? How does effective prevention in schools contribute to healthier, more resilient communities long-term?
Well, you guys, I feel like I'm going to say like, the answer to this, right? But I will say it anyways. We know that a lot of when we think about substance use, misuse, and abuse, right? That it starts from really young, like in our childhood with trauma, right? And so when I think of prevention in schools, like I said, like around, besides just giving students the ability to name their feelings and emotions and being able to tell adults the truth, I think that also some of the prevention is really important related to as our students get into adolescence, around actually having the right language and curriculum for them to actually be able to name the things related to substance use, misuse, and abuse. And I think one of the biggest things that comes with that is that, particularly in schools, we discipline kids, right, for having drugs at school. In case you didn't know, we do. But with that comes a lot of shame, right? So for us, one of the things that I would say is working really well is that several of our high schools have agreed that, so when we're finding students with vapes, right, because that's what we're going to catch them with most of the time at school, is to actually do something really different and not send them home, right? And to not embarrass them or shame them and say, hey, you can stay at school if you'll agree to go through these drug prevention classes, right? We're seeing huge numbers in this particular area of seeing a decrease in suspensions by just this one little thing. And then what happens if they continue to bring like vapes to school, or we continue to get caught? We have sort of a different plan. But I would say for us, that's one of the areas that has been working, which is fantastic, but really around really sort of getting rid of the whole shame about drugs, shame about drugs in your family, shame about drugs with your parents is something that we're continuing to work on. But I would say that's sort of very fundamental thing that has been really hard to break through, but I think we're getting there. Sure.
Do you feel like other schools are adopting that same approach that you're aware of?
Yes and no. I think that systemically we all have really strong, this was a hard topic, right? We have very strong feelings about drugs and substances and sort of the DARE campaign from the 80s that has changed. I want you to know, if you all didn't know, there's a totally new curriculum that came out like in the late 2019 that's totally different, evidence-based, it's very different. But we all like sort of associated drug use with bad people, right? And that's really hard to break. But I think that one of the things when you start to sort of normalize that, and our schools want kids in school, there would be no reason to have them go home where they have the opportunity to do more drugs, right? Doesn't that always feels like the weirdest thing to me? I'm suspending you to go home to partake in the thing that we're asking you not to do. But instead, we just have to bring you in and love you and take care of you and figure this out together. I would say that many of our school districts are figuring that out, but it is really hard because in our brain, we really want to punish people, right, for doing the thing. So,
yeah, good point. Very good. Thank you so much. Gary, how is ODIMSIS prioritizing prevention first approaches within the broader addiction treatment continuum? Yours is two-part. Sorry, I was very excited about this question, actually. And how is the state measuring that effectiveness in reducing substance use before it escalates?
Yeah, in terms of addressing the broader spectrum, kind of that first part, our prevention services division is sector-based, first off. So there are teams that operate inside of school-based prevention services, faith-based, family-based, businesses, community-based services. So you have a team of people that are familiar with resources that exist, depending on exactly what the engagement point is, whether it's a family service issue, whether it's something to the broader community. So I think that's one way that they kind of address prevention first, is just by realizing that prevention exists, again, outside of those crisis continuum spaces. And would you mind repeating that second part of that?
How are we measuring effectiveness in reducing substance use before it escalates?
Absolutely. The first part of that actually starts before any evaluation even occurs. And it starts with the practices and the programming and the interventions that we even select. We want to ensure that those are evidence-based. We want to make sure that those have been repeated over time. We want to make sure that they're appropriate for the populations that we're intervening with. So a lot of kind of our measurement starts in just the very first steps of planning. And then, of course, we care about evaluation. We utilize, inside of our prevention services, we utilize what SAMS calls the SPIF, Strategic Prevention Framework, which is just kind of a model of how you approach problem solving. And evaluation is kind of that last step, but it's found throughout the rest of the model. So it kind of helps guide not so much what you're wanting to find, because sometimes we get unanticipated results. But we have evaluation in mind when we start down the path. We have a great epidemiology team that does a lot of, they kind of crunch our numbers for us. I like to refer to those people as our stat nerds. But they're great at what they do. And in terms of kind of depending on what the intervention is in the space we're working in, they kind of analyze outcomes. I think, like, just to throw a quick example out there, especially for our school-based systems, the Oklahoma Prevention Needs Assessment, it's a survey that's given to students in 6th, 8th, 10th, and 12th grade, kind of rates attitudes around violence, tobacco use, marijuana use, alcohol use, academic failure. But we get some great cohort effects. We get to see some longitudinal data, see how things transition over time. So that's just kind of one example, one kind of really niche example of how we assess results in the moment and over time.
It's really good. Thank you. They tell us it takes a village to raise children. I am certainly of the opinion that it takes a village to measure adequately anything, right? Like just gathering all of that together and wrangling every community partner you can and sharing those measurements is so important. And I think just it's something that Oklahoma in some ways does well, and then other places I think we could really share more together. So thank you so much for that. Zach, you ready? How do public policy decisions and prevention directly impact things like healthcare cost, workforce stability, and long-term community growth?
Yeah, could I sort of address
I would love that.
something
Yeah.
Gary mentioned?
Yeah.
So
Yeah.
I'll get to that, but just building off of this, I think the Oklahoma Prevention and Needs Assessment is one of those foundational tools that we really have to have in place. One of our early priorities at Healthy Minds, and some of you know that we have a policy agenda aligned with data that we understand the gaps in the communities to be. And so we're proposing things to the legislature every year. And one of the first things we proposed was making it mandatory that students are offered the Oklahoma Prevention Needs Assessment. They don't have to take it, and it's anonymous, and parents have to sign off on that. But that schools make this available. Why is that so important? It's because we can't apply data-driven solutions and our resources effectively if we don't understand what the problems are. And the OPNA is the foundation for how we start to have these conversations about what we do in school. TPS uses their OPNA data, districts across the state. Not only is it, macro level planning, such as we can aggregate counties in the state and we can say, hey, there's issues with certain kinds of drug use risk kind of factors. We can actually then go into districts and the administrators can look at the data and decide what works for their students. I mean, what is it actually that we need to be doing so that we're not wasting our resources trying to prevent something. We actually have a bigger issue over here. So I think starting your question there is, this strikes me as a partial answer to your question. I apologize for kind of getting off, but
I like it. Continue.
But if we aren't applying resources to where the data say the resources need to go, we're really not going to get anywhere. I think prevention is really important too, because what we've done is we've really built a mental health system across America. And this isn't something that Oklahoma has unilaterally done. Across America, we built a mental health system that is basically trying to clean up from years and years and years of not doing anything. Right. So we never got ahead and figured out how to detect and identify in primary care settings. We never prevented it even before it needed to be detected by a physician, right? We've siloed mental health and said, there's some mental health, Grand is over here, go see them. When it's so bad that somebody realizes that there's something that needs to be done. In school, that often looks like a gun is found in the locker, or schools are found, schools are detecting drugs and, we catch students with these sorts of things. On the streets, it looks like you're in the back of a squad car and you're going to jail now. Well, these things are the most expensive possible things that we could do. Kicking somebody out of school sets them up for a lifetime of negative interactions with the system that is costing us money. Going into the emergency room is far more expensive than getting treatment at Grand.
Yeah.
Right? You can apply this logic across the board. Frankly, what we are doing is wasting resources. By waiting until a crisis is developed to the point where we are only addressing it in the most expensive possible way, we are wasting resources as a society. Here's what we do about it. Number one, we have to invest in CCBHCs because CCBHCs have a whole continuum of care starting with prevention, and they can get upstream from the jail and they can get upstream from hospitals. Number two, we need to invest in primary care, actually having the training and resources before we even need to send somebody to a CCBHC, somebody who's maybe not a serious mental illness, but we've got anxiety and depression, and the rates of, in some cases, post-pandemic, it was about 50% of us in Oklahoma, right? Primary care is missing a lot of this. Okay, so individuals who die by suicide had seen a primary care physician in the last month of their life 47% of the time. Okay, about half the time when you go into a primary care office and you have massive depression, it's actually detected about half the time. But you start to see a cascade where, okay, you're detected and then you're treated, but only 23% of the time are you treated adequately, right? 9% of the time you're actually getting your condition addressed fully. We've got an issue. So we can start to talk about integrated care, early detection, screening in primary care, getting co-embedded, mental health practitioners in that setting and doing these evidence-based things. And then we've got to talk about actual prevention services in school with the kind of work that Stephanie does at TPS. And if you're deploying evidence-based prevention programming in school, we can prevent 75% of marijuana use later in life. We can prevent 68% of methamphetamine use later in life with appropriate prevention services in schools. We can do skills building things. We can coordinate with outside providers and get that done. That is cheaper than treatment. It is cheaper than treatment. But here's the system we have built, and I'll stop and get off my soapbox and let you move on. The system we have built is that we cannot bill for treatment. We cannot bill for prevention. Grand cannot go and offer primary prevention services in schools and bill anybody and get paid for that. The only way that we have to fund that are through federal block grant dollars that the state of Oklahoma receives, and then we allocate a percentage of those to prevention. We need to increase the percentage of those block grant dollars that we can apply toward prevention. We need to start to rewrite the way that we fund care to incentivize upstream care. Because, by the way, every insurance company has a methodology of looking at and basically saying that you or I are going to be on their plan for 2 years on average. So why would we spend a lot of money trying to prevent something that another insurer is going to benefit from later? Because you didn't develop cancer, you didn't develop so-and-so, right? Let's shift those incentives financially to get upstream and prevent. And we wouldn't have to have this conversation.
Yeah, the numbers are staggering when you move upstream. 68% methamphetamine use, you said, and 79%, 75% marijuana. That's just shocking to me. That's amazing. But that tells you exactly what prevention can do, right, when applied the right way. Daniel, I'm going to jump down to you From the public safety standpoint, how does investing in prevention change the outcomes for law enforcement agencies and those communities that they serve?
Well, long-term prevention is probably the number one thing that we have to do. You have to be able to, a lot of the kids that we deal with, or even adults, they don't have proper tools or resources to deal with their problems. They don't have the coping mechanisms that they need and different things like that. Um, I've been a police officer for almost 28 years, so I've seen a little bit of everything. I've been in part of different events. I was a school resource officer for a number of years, and I worked in the school systems, and I got to see the DARE programs and all this stuff. The big things that we found that does work is teaching kids the ability to cope, to teaching them how to properly address the problems, and be able to do that preventative way shows that you can actually stop people from doing certain things more than an arrest. Arrest doesn't stop anybody from doing anything. A citation doesn't stop them from doing that. Sometimes it even perpetuates the cycle of continuing that same behavior. You know, you could take that as a simple aspect of somebody that, you know, is can't afford even a speeding ticket. You write them a citation. Are they going to put food on their table, or are they going to pay that fine? Well, if they don't pay that fine, their license is suspended. Then if their license is suspended, they can't drive. Well, they're still going to drive. They're going to still put that food on the table. Then the police stop them. They don't have a license. Then what happens? We have to, you know, we take them to jail because they're driving without a license. And all this started from a simple us enforcing that law, but not properly teaching them these coping mechanisms. We have taken those other steps in the future. We have officers that actually respond to the jail and people in those situations, help them get their license back, help them go through these systems, help them get connected with the different mental health services to teach them those coping mechanisms and going through that. And we stop having those repeat offenders. As part of the school resource officer programs that we did a first time offender program where kids that were getting caught with, you know, low level citations, they could come basically spend a week with me and they got to get out of their ticket. We taught them basic coping skills and how to actually deal with those problems and address those. We taught them short-term goals and how to reach those. And over that cycle of running those programs, we had 0 repeat offenders. You know, kids that went off that were going through these things. And the number one thing that we saw is that they had some type of tragedy in their life, whether it was abuse or whether it was a loss of a parent or divorce, and they didn't know how to deal with it. They didn't have, and they were reaching out in any way they can. And so a lot of these different things that we see are kids acting out because they're asking for help and they don't know how to ask. And by being able to teach them the words to be able to say those things is the earliest way we can get them into that prevention cycle to help them to keep them from having to constantly run into law enforcement. Law enforcement's number one problem is when most of our crimes are in the aspect of people that are in some type of abuse of some type of drug, whether it's alcohol, drugs, or whatever.
It's an interesting perspective to hear law enforcement say that arrest, you know, isn't prevention. It's not going to make them stop. It doesn't even solve the problem. I was in a community meeting just after work the other day, and I was chit-chatting before something started, and a lady at the table with me says to this other woman that she knew, well, they'll get arrested and they'll stop. It was just the exact conversation we were having. So to come here today and hear law enforcement say that is not actually what will stop anything is very interesting. Kelsey, thank you for waiting.
Of course.
So from a clinical perspective, how does investing in prevention change the course for individuals and even families maybe? And what does that mean for the broader community when we invest in those things first?
So I want to kind of jump off of
Yeah.
what Daniel was saying. So I used to work in the drug court system. So I saw, you know, adults who had chronic arrests, chronic criminal behaviors, chronic substance use. And when you said arrests don't change anything, it made me think of one client that I had in particular. When I got him as a client, he was 19 years old, so pretty young. And at that point, he had already had over 20 felonies on his record. 19 with 20 felonies, more than his age. And for him, he thought that was going to be the rest of his life because that's what he knew. That's what his family expectation was. That's what his community expectation was. That was the friends that he spent time with. And these weren't like easy felonies. These were like big time, scary things that he was involved in, and scary stuff that he was looking at if he didn't complete this program. And so I just think about in that term, he got arrested, let's say 20 times, and it didn't stop him from using methamphetamine. Even being in the drug court program, it didn't stop him from using methamphetamine. At some point in the program, he had a shift. He had an aha moment where he decided to change his mind and was able to find sobriety and truly changed his life. But it took him literally changing every single piece of his world. He had to distance himself from his mom, from his brother, from his friends, all these people that were integral in who he was, and rebuild that with people that he didn't even know. He had to build trust in humans that trust wasn't even a language that he could have. He didn't know what that was. So it was 3 years of me working with him to develop trust. And that's a lot of work. So to me, prevention is looking at someone like that, at a perspective like that, and thinking, okay, using the phrase upstream, what could we have done for him in elementary school? What could we have done for him in high school? What could we have done for him, for his family, right? How could we have caught some of those red flags early on to set him up and his siblings up for better success? To me, prevention is the chance to catch the why before we have to actually treat the what, because the what is what's destroying someone's life. If we can catch the why at school, at church, at a doctor's office, then we are really setting our community up for success.
Thank you so much. So Gary, I'm going to come back to you for a minute. And for community partners that may be in the room today, how could they support ODEMSIS to strengthen local prevention efforts? What could we do?
Absolutely. Well, I think first, I know I mentioned earlier, our prevention services is sector-based, so multiple points of engagement. And I think that's a really great starting point for conversations deep inside of the communities. Being able to have available resources brought to you sometimes where you don't have to necessarily seek them out is always helpful to kind of get a jump on getting started down a certain path. But being able to engage in multiple access points that are not immediately connected to treatment itself. I think a second way is strategic planning. Again, each of our sectors has different programs and things. You can go onto our website and you can see all the programs we support. Maybe those programs aren't right for you. Now what? And that's where the strategic planning actually takes effect, where we kind of open up that strategic prevention framework, start assessing problems, start building capacity to deal with the problem, start planning some pieces to that, implementing, evaluating. We like to think that, we're experts in prevention science, but our communities are experts on the problems occurring in their own backyards. So we need to leverage both of those skill sets and kind of marry those two things together. And then finally, I think connection. As people, we seek connection. And I think a lot of times when we approach prevention issues, we like to think that we are on an island and we only have ourselves and who is immediately on our team to help with those problems. Because again, we're on an island. But we forgot through those trees, there's a bridge that connects you to another island. So I know one of the things I really enjoy doing is, I don't have the answer for a lot of things. But, I have a community partner over here that just experienced that same issue. And I would love to get you two talking so you can kind of pick their brain, see the struggles they went through, the challenges they went through to get their programming off the ground. So I also think just kind of building greater connection is also a way our prevention services can help communities out.
Zach, I'm going to ask you, do you have additional ideas for us to support those prevention efforts of ODEMSIS or someone like them?
It's a question, do I have ideas for regular folks to support prevention efforts?
Yeah.
Yeah, I mean, my answer to this is not as good as I wish it was.
Okay.
But here's my answer, is that we do need to be talking about this with our local legislated officials, our city councilors. They have to know that it's important, because what typically rises to the top of those equations are other issues. So if we want to talk to them about, hey, mental health matters, and by the way, preventing mental health matters, there's nothing, forgive me, less sexy to individuals who have money to spend on this than prevention. Why? Because it takes a little bit of time to see the outcomes of that. It's a little bit longer length than treatment. But here's what we can talk about, that we actually do have prevention services. There are actually evidence-based programs that we can fund that feel like funding treatment interventions that do have an immediate and measurable impact and effect. Our friends over at ODMH can talk to us about those. So advocate, talk about it, and that's my answer.
It was a good answer. I feel like you just gave us a challenge to find ways to make prevention desirable for people to care about, right? And we can do that, I think, together as a community. So thank you. Stephanie, where do you see the biggest opportunities for partnerships between schools and communities to have it some sort of impact, meaningful impact on prevention?
So I think of school as a community, right? Our school is the community. So I think it's we're all together in the same thing. But I would say that specifically since we're in this space, and of course you had to bring up the OPNA, right? You did. Oh my gosh, right? So the Oklahoma Prevention Needs Assessment, I should tell you well, is something that is not just sitting over here like a weird assessment that we don't look at. We take it very seriously. In fact, the reason and the rationale for us putting in place those suspension diversion programs related to students using drugs was based on the data from OPNA. We could go to their principal and say, not only does your suspensions look pretty horrible, but we want to look at this, right, as well. And it looks like the students in your school are doing this. In fact, I could tell you when right now, specifically exactly what schools have the most alcohol use based on the OPNA, what schools like we might think that students are utilizing certain drugs and we're according to that data, that's not true, right? Like we know that based on that data, 8th grade girls in particular, like in one of our data sets is really the biggest around, like really having a lot of like violence, right, with other girls and utilizing vaping more than you would think. So I want to just first you guys had to talk about that and that we do really database planning. But when I think of our community partners, we obviously have over 30 mental health agencies that support Tulsa Public Schools. We could not have Tulsa Public Schools without them. Honestly, we have some students that really do need mental health supports every day, right? They need it every day. And they can't all be in the hospital. And so that is one of the biggest ways is supporting us through like supporting our mental health agencies. But I would say that the other thing, Zach, that you mentioned that is comes to mind to me all the time is that when you think about our legislature and they talk about like the things that they really support in schools, there is no mandate for us to do drug prevention in elementary schools. Or even like it's schools may choose to do drug prevention. I think it says something like that. You probably know the exact language and which bill it is, which is always crazy to me. So I want you to know it is a bit of a, like I'm having to sell a little bit when we are looking at putting these programs in place because it takes away from instructional minutes that are required, right? So we're having to really figure out how to do this. And that's where our bigger community comes in with the help of philanthropy or mental health agencies, helping us figure out like, how do we get that? Like, how do we teach it? Because the teachers don't have enough time. Can we embed it in a biology unit? Like, right? Does it sit in PE? Instead of it being something that like we really support. So I would say one of the things is really helping us figure out how to do that. And then, like you said, like you all can't bill for doing that for us, but we are trying really hard to figure out how that fits in. And one of the other ways for us is like really reaching out for those big grants, right? That we have in Tulsa Public Schools. We have like the SAMHSA AWARE grant. We have the opioid abatement grant, continuing to do those things, collect the data so that we can put those prevention services in place. But as far as community, we obviously need all the help of our mental health partners, our families. Yeah, I would say all of those things.
Thank you. Thank you. Yeah. So Daniel, what role could businesses and community leaders play in supporting those prevention focused approaches such as diversion or community-based initiatives for law enforcement?
First and foremost, take it serious. Make it a priority in those aspects. You have to be able to make that on the forefront in different things, to be able to show that initiative, to show that push. Because the biggest problem I mean, mental health world will tell you there's no money in mental health unless you're funded by our local agencies. You look at a lot of hospitals over the years, as soon as they go from nonprofit to for-profit, the first thing they get rid of is the mental health wing, because there's not money available for that. It's not profitable in of itself, because a lot of the people that deal with that, they lose their insurance, they lose their job, and go through those different things. So we have to make it a priority. We have to show that it's important to our community and be able to show that we're supportive in all those different areas. But at the end of the day, that the problem that law enforcement faces, and you probably sound like a broken record, is that a lot of these problems continue to fall onto law enforcement. And we don't always have the tools and resources to properly do those things. So our go-to is enforcement. That's part of our job, to write a citation, to arrest somebody, and different things like that. But even if we know the prevention is the best thing, sometimes we don't have that choice. We don't have that alternative. We don't have a place to take them. Facilities are, they're getting better, but in the time periods that I've been around, you've seen it come and go. You've seen mental health facilities come and they build up and they start and they dissipate because the funds run out, and it still continuously falls onto law enforcement. But the key aspect, I think what we've missed over the years, is actually focusing on more of the prevention part of it, of getting in there ahead of it before they become, a drain on society, so to speak. Be able to get in there with the students and go through that process and teach them the abilities to be able to cope and deal with these things long before they're pulling funds and resources from our community.
Thank you, Daniel. I hear you saying that law enforcement is the constant, and really hoping that community partners are able to join forces with you and help assist with those efforts is good. So Kelsey, what are some early warning signs or risk factors that community organizations or members today in this audience should be aware of to support prevention efforts?
Yeah, so substance use and mental health, when you're looking at risk factors or warning signs, they're kind of similar across the board, right? We're talking, do you have someone who's isolating? Do you have someone who, maybe you have a kiddo who was pretty social and had a pretty large group of friends and enjoyed sports or certain activities, and they're all of a sudden saying, I don't want to go to practice today. I want to stay home, or I'm not friends with Joe anymore. Like I'm not friends with them. I don't want to hang out with them. You see them kind of pulling away, or we're even talking adults, not even kids, right? If you see adults kind of doing the same thing, changes in their mood, right? Are they a little more aggressive? Maybe a lot more aggressive. Maybe they're kind of have a hairpin trigger. They are quick to react. Those types of things are really easy to look at. Declining school attendance, right? If they're typically showing up every single day, they're not skipping school, and then all of a sudden you're getting calls from your school and they're like, oh, Susie's not here today. That's weird, right? Let's not sweep that under the rug. Let's talk about that. I dropped her off. Why isn't she at school? What happened? So anything that feels out of the ordinary, I would consider that a warning sign. Risk factors, we're talking about ACE, so adverse childhood experiences. That's a scale of 10 different things over the course of 0 to 18. And that's how we look at historical trauma for someone. That's kind of the baseline trauma screen that we use in a clinical setting to really determine, hey, like, what's this person looking at? What's their life trajectory looking at? If you have someone who is got a score of 10, that means that they've gone through pretty severe trauma, pretty severe experiences throughout their formative adolescent childhood years that impacts their physical health, their mental health, their ability to maintain employment, their ability to maintain connections, all of that throughout their life. And those are huge risk factors to look at. Untreated anxiety, untreated depression, untreated mental health in general, they're going to try to find a way to cope. And if they're not getting treatment, they're going to use the coping skills that are the most available to them, that their community, their society, their connections say, hey, use this, right? I'm thinking of, we're talking about kids a lot, and I feel for you because you have kind of a mountain ahead of you in some of the things that to treat and or to address. And I'm thinking like with vaping, the marketing for vaping is huge, right? Trying to get kids to stop when it is told it tastes good, it's fun, it's not going to hurt you. Like the amount of effort to find or to get kids addicted to something is wild. And so helping them kind of understand, hey, just because mom and dad vape, just because mom and dad smoke, doesn't mean that it's good for you, right? Helping them kind of relearn family norms is huge. I think family treatment is a really big prevention strategy that we can look at, and it doesn't have to necessarily mean family treatment in a clinical setting, but supporting families, right? Not being afraid to talk to mom and dad when kids are acting a little weird or acting a little off. Talking to their support systems, talking to the aunt or the grandmother, whoever the caregiver is, bringing the family system in, and also helping give them language. I've learned in my career that the language around addiction is really what pushes the stigma. And that's what pushes people from not wanting to talk about it, not wanting to come forward to say, I have a problem. I just think about the way that even people who struggle with addiction talk about themselves, right? When someone's been sober for a few years, they'll say, I've got 5 years clean. Well, what's the opposite of clean? Dirty, right? So if you've got clean, then you automatically have that assumption of dirty as well. I had clients when they would have a positive drug test. Oh, I tested dirty already. There's shame. That's stigma, you know? So changing the language of how we talk about substances, how we talk about substance use and misuse, how we label things, all of that opens up the chance for someone to talk. Because if I feel like I'm going to be this dirty person, I'm probably not going to tell anybody about this dirty thing that I'm doing. I already feel bad about it. I don't want someone else to put that on me as well. So helping give language that is safe, that is open and inviting. And like Gary was saying, connection, helping people find connection and maintain connection, whether that's at school, in your family, in your church. I think that's life-changing.
Thank you, Kelsey. That's really good. I think about connection often, right? In our role, my role here is employee experience, and I think about building that connection is so important, and it leads to all of those things. Do they have somebody, even an employee, do they have somebody they feel connected enough and safe enough to have that conversation with? They might be able to talk about. So important. So Zach, I'm going to jump to you for local leaders and organizations, which I know we have some in this room. What are I'm not going to say the most, but what are some practical ways that we as individuals can influence or advocate for policies that prioritize prevention? You spoke about this a little bit, right? But over that crisis response, we know it's more expensive. What else?
Yeah, I mean, cost is a big one. We did some research that essentially found that for everybody in a mental health crisis who's going to an emergency room, which often happens, you're probably just sitting in a bed, frankly, waiting for a mental health bed to open up somewhere. If we were to divert all of those folks to a evidence-based crisis facility like the one on this campus for mental health, we would save the state of Oklahoma more than $400 million a year. It's just better and cheaper, and you're going to get better outcomes. But I also think that, you know, when we're talking to, I mentioned earlier, hey, talk to your legislators about this. I think we're doing a disservice by talking about mental health as its own thing. And you're hearing this on the panel, and I think multiple, many of us have already kind of expressed a sentiment. Mental health shouldn't be mental health. So what we're talking about at Healthy Minds is we believe, and our vision as an organization is that mental health is the catalyst for a more prosperous state. We're not going to get there by having a bunch of mental health facilities all over our communities. It's not how we're going to get there. How are we going to get there is by thinking about mental health as a core component of how we succeed in every system that we have. Right? Mental health is a part of education because students with appropriate mental health supports available to them succeed on standardized tests by about 11 percentage points more than other schools that don't have mental health supports. Right? Mental health is how we get a better economy Because those of us who have massive depression or even any kind of depression, frankly, the studies show, you're losing about 30 days of productivity a year at your employer from either absenteeism or presenteeism, which is like you're there, but you're not really there. That's happening. And depression is something that is affecting large percentages of our workforce, right? Mental health is how we achieve better outcomes in public safety. Because what we're doing is we're asking, in some cases, law enforcement to spend it, by some measures, 50% of their time trying to go out there and be clinicians, dealing with the issues that the mental health system hasn't had the capacity to deal with, right? And it's creating a situation that is unsafe, that's unwise with our resources, and it's taxing our time for individuals who are supposed to be enforcing the law and keeping us all safe, right? Mental health should be just something that is baked into how we succeed at every level of our state success. But I think if we start to frame the conversation that way, and I'll say one more thing because of the point about healthcare and hospitals tend to lose their mental health beds. It's true. If you compare a mental health unit to a cardiac unit, cardiac makes a lot more money. So in a short-term business decision, that makes sense for the hospital to do. But mental health is the number one reason why cardiac costs what it does. Heart disease issues are the number one driver of healthcare costs in America, chronic heart disease and obesity. But heart disease costs 3 times more to treat when there's an undiagnosed or untreated mental health condition. Mental health is driving up costs across healthcare. So again, let's take that barrier to success out of the way so that healthcare generally can be more efficient and we can reduce total costs of care. If we start to think like that, we'll transform outcomes and we'll put mental health at the forefront.
I'm just thinking about the presenteeism, right? And the absenteeism and being in the workforce world. And you said earlier that post-COVID, 50% of us are experiencing depression or anxiety. Just imagine those days that are, lost in some ways. Okay, I have one final question for everyone. You guys ready for that? All right. Let's start with Captain Daniel. It's probably supposed to be Captain Hurst, but I've wanted to say Captain Daniel all day, just so you know. I don't know.
Church, you
It's, it sounds like it's like your preschool teacher name. I like it, right? So, okay. So if every organization or person in this room committed to one concrete action after today, focused on prevention, what do you think that should be?
That's a big question. Still at the end of the day, we want to be able to help everybody that's already going through this. But still, if we could focus our full attention on the prevention aspect of our youth, I think that's always the most important because you're got to start in a place where you can continue long into the future. I'm not saying, people are, that are already of age or hopeless by no means. There's a lot of prevention techniques that can help them and do different things. But my heart and my passion for being in the law enforcement has always been in reference to our youth and be able to have an impact and help them through the processes of daily life and be able to teach them how to deal with these situations and cope and process it and learn these different things. And I think if everybody took the time to be able to reinforce that, where it's not always falling on one entity in of itself, that we could all partner together in that aspect and take the time to really push that initiative, I think we'll see vast changes in just a few years. I think you hit the point on a lot of different things. A lot of our kids and test scores and all the different feeling a part of something is dramatically affected by the mental health of all the things that they have to deal with. They have to deal with so much more than we did even just 10 years ago. You go back 20 years ago, you look at all those different things. When the schools actually felt comfortable being a part of the system and helping the kids, we kind of got away from that for a long time. We are pushing back that agenda, and it is getting back where the schools are making that investment. For numbers of years, I could see law enforcement having to fill that role. We were called to every kid every time they found a vape pen or drugs or whatever. We were called to every one of those. That was so taxing for our law enforcement. Our day shift officers, almost 50% of their time were responding to schools to write a citation to a kid. We know that's not successful because it's the same things that happen over and over again. And it's just nice to see that prevention, going across the board and schools changing and be able to take that initiative. But if we all did that as a community with all our partners, I think we could see a long-term success in those situations.
Yeah, thank you. Let's, with that focus on youth, Stephanie, do you want to take that question next? What's one concrete action that we could do today? When we leave here, what could we do?
Oh, you can just come volunteer right now. So I'll make sure and share the website with you. I am not kidding at all because I am telling you the game changer for our kids is when they have an adult who cares about them, right? And it's true. Sometimes I told you they don't always understand our teacher love language, right? Like they don't. So if that would change everything in our schools. So if you want to, we have mentoring programs, we have volunteering programs. You can come in my office. We'll take you like on a drive by, like you would maybe through our schools. It would be fantastic. I actually we have a need in our schools for more adults, and that would be like a game changer. Yep.
That's good. Thank you. Gary, how about you? One thing we could do.
One thing you can do, take care of yourselves. A lot of the change that we want to see in our communities starts with the people in this room. So please ensure that you're taking care of yourselves.
It's a good one and often forgotten, I think, you know. How about you, Zach?
Gary took my answer.
Oh, gosh.
So, I've mentioned several points about, making sure that we're talking to our elected officials. Yes, we have to understand that mental health is important, not because of mental health, but because mental health, it can be the catalyst for a more prosperous state in all of the categories that we know that our leaders care about: the economy, education, healthcare costs, things like that. But I'm going to take a little bit of a different tack with this final answer. Because I forget, Kelsey, if you mentioned it. This is really about connection. What is connection really about? Connection is really about humanity, right? It's what does it mean to be a human? And unfortunately, we live in a society that is designed not to facilitate that, right? We live in a society that we all kind of spend a lot of time here. We build neighborhoods where we don't actually walk or connect to other neighborhoods. Nobody sits out on their front porch anymore. Participation in social clubs is at its lowest rate since the advent of the television, right? This has been happening for some time. We are becoming increasingly divided and disconnected. We even separate ourselves by our political views, both online and the communities that we live in, right? So connection, get connected, recognize it for those friends in your life, the children in your life. This is really about connection, and lack of connection is truly driving many of the both physical and mental health ills that we have as a society. I am convinced of this. So advocate for that connection, provide opportunities for connection in your family. And I think that's one of the most important things we could do.
Yeah, so Gary laid the foundation for connection. You and Gary are just on the same wavelength today. Yeah. How about you, Kelsey? What's one thing?
They stole my answer. Truly, I was thinking connection is the one thing that we can do. Because prevention, we've been talking a lot about kids, but prevention isn't just siloed into kids, right? Connection with everybody, with your aging parents, with your coworkers, with your children, with the person that checks you out at Quick Trip, all of those people, connecting with them. That one connection could actually change someone's reality that day and potentially down the line. Leading up to this week, my daughter has been very into National Geographic shows recently. I have a 3-year-old. Anyone who works with me knows I talk about her all the time. But we've been very into like The Way of the Penguins, The Way of Whales, The Way of Chimpanzees, all of these shows. And the thing that keeps these animals alive is connection. I was sitting here thinking about, I'm like, I just watched a program about orcas and how there was a single orca and the connection came. And once they had connection, they survived. And the penguins, these babies survived because they were taught connection, So I don't want to, sound like a broken record, but I'm going to. Connection is really what will change someone's life.
That's really good. Yes. Yeah. I love 3-year-olds. Yes.
Yeah.
I feel like they show us a whole new world that we should all connect back to sometimes. Yeah. So, we do have a few questions from the audience, I think. And we'll have time for questions for anyone in the audience. Thank you all for your answers so far. We have Brandy, one of our virtual viewers, who says, Stephanie, I think this is going to be for you. Are there preventative resources in all Tulsa schools, including both Tulsa and Union, that you're aware of?
Yes, on like the broadest term, I would say that like Zach had mentioned, and I think you mentioned as well, when it comes to like if we're talking something specific around like evidence-based curriculum, it doesn't always look like this is the drug prevention curriculum. So I want to say that that gets a little like there's no box in the council. Well, there could be, but I don't think there is. There's a box in the counselor's office that says drug prevention activities, right? So it kind of goes back to recognizing like that continuum between like pre-K through 12th grade and what makes sense. And so we do have sort of starting with what we would call like social emotional learning, right? And like life skills. We have specific, curriculum around like Botman's life skills that actually embedded in those, and second step curriculum that actually have like drug prevention units sort of embedded. So the answer is yes. And then, like for Tulsa Public Schools, because we have gotten like amazing support and a grant and a lot of help from the Zero Foundation in the past on like how do we tier this? We actually have sort of additional curriculum related to like, so this would be our sort of tier one, our basic curriculum. And then we actually have small groups for students who keep bringing vapes to school. And we're having this sort of, right, like, so we have like a tier two intervention that looks different all the way to then like we have been working like even into the next year, what is the specific thing we need for sort of tier three, which we do actually have like even a more targeted curriculum for tier three, where students who are having like habitual drug use. So, and I don't know all of unions, but I know that we all share that sort of universal sort of like prevention curriculum.
Yeah, thank you so much. Do we have any questions in the audience for our guest? I have a couple, but I'll wait. Yes, yes.
Like learning family norms. Not sure who I'm hearing from, so I forgot. What does that look like? Because I feel like that has to be such a challenge to overcome. Maybe if there is shame or unwillingness to participate, or do you find the opposite? Do you find that maybe you were anticipating a lot of resistance and you don't find it? I'm thinking about a kiddo who goes home to a bad environment, setting them up for potential success, but like how do you wrap around kind of that family union?
Yeah, I'll take that.
Yeah.
So at Grand specifically, we actually have a program called Wraparound. So I'm glad that you used that language. That treats the family. So the child is kind of the identified client, if you will, but we look at the family system as a whole, and we have a role called a family support provider. So they are someone with lived experience. As a parent with a kiddo who's having a hard time, whatever that hard time looks like, right? It can be, it's extreme for them. And so that family support provider comes in and really partners with that parent and says, this is what we can start to do differently. And it's a long program. We're not talking 6 weeks. We're talking like this could be up to a year of work where they're going into the home. They're not expecting them to come here. They're not expecting them to meet at school. We're going into their home and we're becoming part of their family too. But then it goes beyond that and it looks at what community supports do you have? And if you tell us that you have none, then that's where we're starting and we're going to help you develop support. So do you need someone that you can talk to because maybe you are using substances, whatever that is. So let's get you connected with a mental health professional as a parent to support that. Are you struggling with how to discipline your kid, how to have vulnerable conversations? Let's have a family meal together. Let's have conversations and connect. All of that to really support the family as a whole, but also bring in what, as Tricia said earlier, what does that village look like? To me, prevention isn't a silo. It truly is, it takes a village to raise a kid. It takes a village to create prevention. And so to me, that's the first thing that I thought of with your question is this is something that we are doing right now. I think at the school level, it's talking to the parents, finding out what are those barriers? What are you dealing with? And creating a situation or an environment where parents feel safe to come into the counselor's office and say, I'm really struggling right now. I don't have a job. I haven't worked in 6 months. We don't have food to put on the table. I'm really stressed out and worried, and this is the only tool that I have to cope, and I don't know what to do. And that can be really scary because there's people who get involved at that time that can make or break your family, or it feels that way. I'm thinking of prevention with pregnant women, right? Pregnant women who are using. There There are so many women who do not seek treatment, do not seek help when they're pregnant because of the stigma and the fear of their child being put in DHS custody. So there are campaigns like Tough as a Mother that really work with pregnant women to get them connected with treatment. So that way, when they do go into labor and they go into that delivery room, there is some foundational stuff set in place so that way DHS can look at it and say, you know what? Yeah, this was an issue. And yeah, there are drugs in this baby's system or in the mom's cord blood. But this mother and her environment have done a lot of work to change behaviors. So this baby may not actually be at risk anymore. So we don't need to take the baby from mom. Let's put some safety guards in place to make sure that they're okay when they go home. But we don't have to do a true removal. Those types of things, I think, are what we can look at and what we can support.
How about any other questions from our audience? Yes.
Very important. We need to discuss, but especially about primary care. How do we leverage somebody who's in a position to help and listen to stagger? It took me back to my own experience on primary care. They actually literally asked the question, "You're not suicidal, are you?" And I didn't know, but we're a fool way to ask that. So how do we work within the primary care system and set up a fee-for-service model typically where it's incentivized to get more and more people through the door, not really focus and spend time to actually need to address the issue where it can be addressed? Like, what are some of the things we are being done on that front to address it?
Yeah, it starts with training. Medical doctors get maybe a seminar on substance use disorder or maybe like a day within a mental health class, and that's kind of what they get. And that's sad when the numbers that we're seeing of individuals with mental health and substance use disorder are so vast, and primary care is the entry point into healthcare. But again, we've treated healthcare and mental health care as different and separate. And we've asked the population just figure it out, like go here, it's up to you. And there's a couple things that we could do. Number one, screening. Now, physicians will say, I don't really want to screen because if I catch something, then what do I do about it? I don't really know what to do about it. Well, guess what, buddy? If you decide to not care about whether somebody has cancer, that should be on your license, right? This is a mental health issue, this is a healthcare issue, and that's your job and you're a physician. So screen. There are things that we can do. Okay, once you detect a positive screen, okay, we can talk about referrals, but really 60% of the time, based on the training that physicians do get, we should be able to treat most behavioral health conditions in the primary care office effectively. I don't mean just a pill. I mean, we can give you the medication that you need, which likely should be a temporary solution, right? And then connect you with the therapy that you need, right? So you should have a relationship with either an embedded therapist or some sort of behavioral health support in your office. Or we can get you that connection where there's like a warm handoff and not like a, hey, go call this office and make an appointment. In Healthy Minds, we've been fortunate to receive a $5.5 million grant from the Tobacco Settlement Endowment Trust to launch the Oklahoma Integrated Care Resource Center. So what we are going to be doing is bringing the best minds nationally to Oklahoma to train physician offices and health systems for how to do what we would call integrated behavioral health care. That's everything from a bare minimum screening up to we should actually be measuring your progress and doing it over time like a vital sign. You would check, your blood pressure and weight and all those things, your mental health status, and adjust your treatment accordingly over time. Help physician offices to understand how to do that, and with that technical assistance, then we're actually going to be able to offer funding for some clinics to integrate what we would call the best gold standard practice that research indicates has all kinds of benefits to costs and patient outcomes, which is called the collaborative care model. And it's where we can take a psychiatrist who would normally do a one-on-one patient contact and actually spread that psychiatrist over dozens and potentially hundreds of patients by managing care in partnership with primary care physicians and embedded behavioral health case managers in primary care clinics. And people who go through this model have remission rates and diversion rates, talk about cost savings from hospitals and other things at enormous value to society. So at a bare minimum, just to answer your question, we better be screening, we better have referral pathways, but there are ways to integrate it into the primary care clinic that we could train.
maybe impacted upstream too, right? And the education of our physicians related to behavioral health, as you mentioned, how could we teach them to ask that question differently? The way that you were asked that question would make you feel not great about answering, yes, actually I am, right? So yeah, how could we do that? Kelsey, you struck a chord when you mentioned pregnant moms. So we have a question from the virtual audience asking if you know of ways to volunteer for supporting pregnant moms toward becoming sober.
Yeah. So the organization that I spoke of earlier, Tough as a Mother, I think that's a great place to start. They're throughout all of Oklahoma, and they really are passionate about connecting pregnant women with the resources that they need for substance use and mental health treatment. I think that's probably the best place to start. They would be able to get you connected with local organizations, local nonprofits who are probably doing the work with pregnant women, with pregnant outreach centers, places like that.
Yeah, thank you so much.
Yeah.
All right. Well, I actually just got an introduction to Tough as a Mother from our friends at the Evolution Foundation. And it was very, very interesting what they're doing. So I would echo certainly look into that. Thank you all so much for being here. Thanks for joining our panel. Thanks for sharing your insight. Zach, you gave me so many points that I may have to talk to you about later. I was scribbling down the facts as fast as I could. Gary, you just spoke to my soul when you talked about connection. I'm going to tell you, my platform, if I had one, is if I could get on a soapbox, is workplace besties, right? You need one. You need one for lots of reasons. There's certainly great mental health benefits from having a workplace bestie as well, for sure. And so just thank you so much. And Captain Daniel Hurst, I just want to say your name repeatedly. And I just thank you so much. He was fun in the prep call. He said, I don't have a filter sometimes. And so, but I appreciate,
Best.
right. No, you did great. And I just appreciate you being willing to come and be candid with us. I think that's so important. And so, and I'm going to be contacting Stephanie to volunteer for sure. Well, thank you so much again for coming. Thank you so much for being here. Our gracious speakers will be at the stage for just a few minutes if you'd like to come up and chat with them. And we really look forward to seeing you. And I hope that maybe you come and you bring a friend also to our next community lunch and learn. Thank you so much.